guys! It's Danny! Oh my god, it's been so long. You said I'd see you next week, and that was like a year ago. I just am not responsible. I'm just being responsible for many other things in my life, trying to figure out what I'm doing. As most of you know, I'm in nursing school, and it's taking up a lot of my time. This is my semester off, and I decided that I wanted to get experience, so I took on a PSW role in home care. So that's what I've been doing. What have you been doing with your life? Leave comments below. Today I thought that I would talk about caregiver burden. Not only have I been experiencing it myself, being a PSW now, getting more experience with clients that are going through like traumatic injuries or who have been diagnosed with disorders or diseases that they need help with their activities of daily living now. So, which is where I step in and come and help them in their homes. I really do think I want to get into hospital work once I graduate, but I really like the idea of home care because it gives the clients a sense of dignity too, being able to stay home, and I think it's just cool that you can go into their home and make them feel comfortable. It's probably a little awkward for them at first, as I know because I did have a home care nurse when I was going through chemo. They would only be there for about half an hour, flushing my PICC line and, you know, doing care for that. And I take that experience that I've had with a nurse coming in and kind of applying that to my clients, just trying to make them feel more comfortable. Family members have to start gaining trust with the PSWs and nurses coming in, and it's a really hard thing to do, which I completely understand. So it's tiptoeing around that, and it's getting to know the families and things like that I really like about home care. And seeing them in their own comfort zones and kind of opening up to you. So that's what I really like about it. I don't know. I've been really happy to be getting this experience and just really been trying to apply that to my future as a nurse when I graduate. So yeah, there are ways of coping with, you know, dealing with people who have been through traumatic injuries. So getting them to talk and open up is emotional for them, and it's really emotional for me because I've had family members go through traumatic events, so it really helps me to put into perspective what they're going through and how I can help them. Not only is it affecting the person that needs the care, it's also affecting the person that's giving the care. So not only me, myself as a PSW, but the family members, the significant others, they're all being affected. I think that's really important to keep in mind when you know somebody's going through cancer or anything traumatic really. Or stressor, like any kind of stressor really, you have to think about the people that are giving the care as well. There could be some medications that you're on that kind of change your personality, so that could be affecting the family members and peers around that person as well. They might get a little bit frustrated too. Not only may some of the drugs change their mood and alter their states, but it could also be just the fact that they're trying to get better and it's really frustrating. So people that have cancer, sometimes they get like neuropathy in their fingers and things like that. So things that they used to be able to like grab easily and touch and feel, like they can't do that anymore. And same with even just if you're being really sick and you want to go out somewhere, it's debilitating. Like you can't do the things normally that you would have done if you weren't going through what you're going through. And same with my clients, just being able to see them take their gradual steps back to recovery is amazing. It's the best feeling I've ever felt. Like I met this guy once and I almost cried the second day I met him because I saw him walk so much better. So it's really cool to see, and I can reflect on that with when I had cancer, just how the treatments affect you so greatly. Like personally for me, when I had my chemo treatment, I would be so sick for a full week, like not be able to do anything at all, and then the week after would be amazing. Like I'd be back to my normal self. I wouldn't be, you know, down. I wouldn't feel like crap. So yeah, so I think it's also really important to think about the people that are taking care of the person with the health issue, because I know for a fact that my family was obviously really upset when I got diagnosed, but also going through the entire process, because not only am I feeling like crap while I'm getting chemo because I reacted horribly to it. Like I would start throwing up before I even got into the hospital just because I was so anxious about it, and just a bunch of different emotions, and your brain plays crazy tricks on you. But I know for a fact that, you know, your family takes it to heart and they want to help you, and the fact that they can't do anything to help you stop feeling that way, it's really, really emotional for them, and it's really, really hard to accept. So I just think that that's a really important factor. Not only is it emotionally draining for the caregiver, but that a lot of stress is induced during these times, trying to care for somebody that you love. And we were actually just talking about this in class. So I'm trying to like relate what I'm learning in my experiences with being a PSW and being in nursing school to real life. We were just talking in school about stress, what's really overlooked, which is very true, because a lot of doctors are just like, you know, they write off a lot of things like, oh, it's just stress or anxiety, and they say it's just anxiety. And it's like, but really, anxiety is a pretty crippling thing, especially if you have a lot of it in your life, like going through something called caregiver burnout, which happens when you're caring for somebody that you love, and you're drained. You're basically like, you can be emotionally, physically drained, and you just feel tired all the time, and just, you know, it can cause a lot of like mental illnesses like depression, and on top of that, obviously more anxiety, and it just keeps building and building and building. And we were talking in class about how many hormones are released when you're stressed, and it's crazy. Your body is actually affected by the stress. So when people are saying it's just stress, be like, mm-mm. If you are a caregiver, or you know anybody who is caring for somebody that has cancer or has some kind of illness or ailment or disorder where they are stressed or they need help, it doesn't hurt to ask for help. Like, I know that a lot of my clients are really, they're in denial, basically. Like, they think that they can do it themselves, or they think, you know, I'm the mother, I should be the one to take care of my son who's going through this really intense treatment right now. Well, sometimes you need to give yourself a break. So call somebody, you know, like that's why there's PSWs. Things that you normally wouldn't need help with, you need help with. So it's really, really hard to accept, and it's really hard to admit that you need help, but it's really, really, really important, because if you can't do your job as a caregiver, you know, caring for your son or your daughter or your mom who needs you, they're in pain, then if you can't even take care of yourself, then you won't be able to take care of them properly. So it's really important to get the help that you need before you reach like your burnout point. Yeah, you'll get through it, but you'll feel like crap after. And I know myself, I'm pretty stubborn, so I mean, I need to take my own advice and ask for help more. But you know, it's a learning curve, and it's something that you've probably never been through before. But if you have, then you know. Ask for some dang help. A bunch of different facilities that can help you, whether it be PSWs or nurses that can come into your home, or places that you can go even just for counseling. It could be one-on-one counseling, or it could be some kind of life coach that can help you set up how to deal with your stress, set up like an exercise plan or something like that, or if you're getting into those more depressive states, you might want to do some meditations or something like that, just to clear your mind, and it'll actually really help your body relax as well, so you're not producing all those stress hormones all the time. You actually because you need to take time for yourself. And I think that's a really big issue with caregivers, is that you're so focused on caring for the individual that needs your help, they really do need your help, that you forget about yourself. Go do those things that make you happy. It'll really actually make the person you're caring for happy to see you happy. Because if you're just, you know, coming into the room saying, okay, what can I do for you today? Like, here we go again. We're going to do this all over again. I'm going to get tired. You're going to get bored of me. It's going to be a vicious cycle of just, yay, my life sucks. Then no, like, you need help, and you need to take time for yourself. So, the end. That is my rant. I don't know if it was informative. I don't know. Yeah! Ta-da! That was it. Okay. Well, I would say see you next week, but you know how I do. So, see you when I see you. Bye!